Acupuncture is an effective treatment for back pain in seniors, and sometimes it's covered by US Medicare Credit. Getty Images. Unsplash Acupuncture is a safe and effective treatment for back pain in older people, according to new research. Chronic back pain. For the study, participants aged 60 and older showed greater improvement in both physical function and reduced pain when treated with the traditional Chinese method of inserting needles into specific meridians on the body, when compared to common medical care. According to new research, affecting over 1 in 3 older adults, the condition is the leading cause of disability worldwide and one of the key drivers of the opioid addiction. But treatment options like pain-relieving drugs have a somewhat modest effect. They often reduce pain by about a third. Bistan can help people function better, said study lead author Dr. Linda Barth, who researched alternative solutions. The Back in Action clinical trial by the Kaiser Permanente Center for Health Research enrolled 800 participants, including men and women over 60 with a medical history of low back pain, for at least 3 months. While acupuncture has been found to be safe and effective for chronic low back pain in adults overall, few studies have focused on senior citizens. A third of the participants received up to 15 acupuncture treatments over 3 months, while another third received an additional 6 acupuncture treatments over the following 3 months. 3 study milestones. After 3, 6, and 12 months from enrollment, participants provided self-assessment of their pain and physical limitations. They agreed or disagreed with 24 statements that describe everyday activities made difficult because of back pain. Their findings, published in JAMA Network Open, showed that at the 6-month and 12-month assessment, both groups who received acupuncture had greater reductions in pain disability than those who received usual medical care alone. The acupuncture-treated groups also had reduced pain intensity and greater physical function after 6 months compared to participants who did not receive acupuncture. More acupuncture. Good news: how acupuncture may ease symptoms of menopause. Tortoise gets second chance after healing with acupuncture. We found that the size of this effect, while modest, was positive and sustained, said Dr. DeBarth, who works with the California-based Kaiser Permanente Research Group. She explained what sets the Back in Action study apart from the fact that it's large and randomized controlled. It was focused specifically on adults 65 years of age and older, and it was pragmatically designed to involve seniors from multiple regions of the country, so the demographics were consistent with the US Census. Most importantly, they worked with licensed acupuncturists in these communities who are most likely to deliver these services. The research team suggested that access to acupuncture is important, but if the practitioners could bill Medicare directly, it could greatly improve access to such services. 5 years ago, Medicare agreed to begin covering limited numbers of acupuncture treatments for lower back pain, but only when administered or supervised by a physician or other qualified provider in a hospital or clinic setting. That means state-licensed, independent, community-based acupuncturists, who comprise the vast majority of providers, are not considered qualified and thus cannot bill Medicare directly under current law. Today, Medicare covers a maximum of 12 acupuncture treatments within a 90-day period in a doctor's office or hospital. If the patient shows improvement, Medicare may cover up to 8 additional treatments within the same 12-month period, with the patient responsible for a $20 copay after meeting their Part B deductible. The Back in Action study was undertaken as part of the NIH's Helping to End Addiction Long-Term or HEAL initiative, which seeks to speed scientific solutions to stem the opioid crisis, according to UPI News. UPI talked to experts who were surprised that the effects lasted until the end of 12 months after only 3 months for once-weekly sessions, which can't be said about pain pills. The effects stop after you stop taking the pills. Not so for acupuncture, according to this study. This study shows that achieving back pain relief from acupuncture is verifiable and replicable, and that treatments can make huge differences in people's lives at 1 year out. Amy Major, for the American Society of Acupuncturists, told UPI. Poke your friends and family with the news on social media.